Stress in America. Take cover, walk carefully, keep your heads down. Those are the words we might imagine hearing in battle, but they're the same feelings some Americans experience every day. This might sound a little dramatic, but for many Americans, a stressful day can feel just like a battlefield. As pointed out in the previous section, the APA has been generating a survey since 2007 that looks at the condition of stress across the American landscape. The results from the 2015 report indicate that Americans are feeling more stressed. Since 2007, Americans have reported that their levels of stress are closely related to money and work. More recent results have shown that women and younger Americans are two demographic populations that seem to display higher levels of stress. Interestingly, the 2015 results report that family pressures are increasingly creating a stressful environment, and perhaps most significantly, the impact of discrimination is having an increasing effect on reported stress levels. The survey indicated that 47% of adult Americans have experienced a major form of discrimination. So who's feeling the most stressed out due to discrimination? Well, millennials are the population group who most often report higher discrimination influences. Millennials are defined as those being between the ages of 18 and 36 years of age. Survey respondents reported discrimination at the following levels. Millennials reported them at 75%, Gen Xers 72%, Baby Boomers 67%, and the mature silent generation 56%. Between 2012 and 2015, there has been a significant upward trend in the U.S. adults' perception of health. 34% of adults are reporting that their stress level has increased, and 78% of adults are reporting that they are experiencing at least one symptom of stress. Not only are Americans reporting a decrease in their overall health, they're also reporting increases in symptoms related to mental health. As you watch this following video, please note that long-term exposure to stress can lead to chronic health issues. It is important to remember that not only negative things can cause stress. As the video will point out, positive events can create stress as well.
Money, traffic, relationships, health issues, we all encounter circumstances that cause us stress. So Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, is back to stress what we should know. Welcome back.
Oh, thank you. Always great to be here. You know, there is more than enough ready to stress us all out. Many things we deal with: financial distress, grieve the loss of loved ones. And a lot of people think that only negative things can cause stress, but there are many positive things in our lives that cause stress as well. Getting married, having a job promotion or a new job. And of course, our whole society is on information overload. We are all constantly on call. We have computers, we have tablets, we have phones, and we're always checking them.
I think I may have just got a few emails. And you mentioned positive stress. Stress, when it's acute, can actually at times be beneficial. It's in fact a normal response to a pressure situation. It just may motivate you to do a better job. But here's the reality. Unmanaged chronic stress, it can be hazardous to your health. So think of stress a little bit like this rubber band. I'm putting a lot of pressure on this. If you don't release it at some point, this band could snap. And so could a person if you're placed under continued chronic stress. So that leads to the question, how do we recognize these signs of stress? We're going to take a look at a couple of scenarios. Because if you don't recognize signs of stress, you can't treat it, right?
That's exactly right. The first thing is to acknowledge that you are stressed. So first, do you have trouble juggling your many obligations? And this may be a familiar scene, multitasking, trying to get things done on a day-to-day basis. Are you experiencing anger more frequently in common situations? And this may also look familiar. So here you are, in traffic and just can't take it. And do you overeat or undereat when you feel stressed. And of course, there are many situations in where we are comforting ourselves in stress, and sometimes stress makes it so that we just don't feel like eating at all. So the key is to acknowledge that you're stressed and to find out how stress affects you.
Let's talk about what stress can do. You're going to have emotional symptoms when you're stressed out. Anxiety being very common, which can in some cases lead to depression. It can also change your sex drive and even cause a lack of focus. Of course, these make life and enjoying life very difficult. Here's the reality though, stress, which is a mental thing, causes physical symptoms, and it has physiologic realities like sleep disturbances. You can develop muscle tension over time. People sometimes have anxiety attacks that bring on chest pain and fatigue, as well as frequent headaches. Now, you may experience both emotional and physical symptoms, but be sure to talk with your doctor. Don't assume those physical symptoms are just due to stress without being evaluated.
That is so critical. A recent study suggested that over 75% of doctors' office visits were related to conditions that are affected by stress. And there are many, many chronic health conditions that we have links to stress that we know.
Stressful situations actually cause the release of hormones as well as chemicals in your brain. And if you have long-term activation of these hormones, it can actually increase the risk of many diseases. And the first one of those would be obesity. And these end up being self-reinforcing processes that then can increase your risk of heart disease. It can actually cause digestive issues, as well as, believe it or not, memory impairment over time. It can depress your immune system, and it can even cause fertility problems in some.
And many people admit that they don't manage stress very well. I gave you the first A at the beginning, and that is to acknowledge stress and understand how it affects you. I'm going to give 4 more A's that people can remember that might help lead them to ways in which they can reduce stress. The first of all is avoid it. Many of us know situations that are going to put us under stress, and we go there anyway. So avoid stress when you can. Get out in front of things and take control. The second thing is alter circumstances where you can. And if you can't find that you can do that on your own, then communicate with friends, family, and sometimes your medical professional to help you get a better course to manage your stress. And the last 2 are also really important. One is to adapt, and the other one is to accept. Sometimes you can use positive thinking, and sometimes you just have to change your expectations in order to manage your stress better. And for more tips on managing stress and the potential health consequences of stress, go to gethealthystayhealthy.com.
And you can visit thedoctorstv.com for additional information. Dr. Lucille, thank you, as always.
Americans are also noted to spend about 6.4 hours each day in activities that involve lying or sitting. And most startling is the fact that 45% of adults report this type of activity for 6 to 12 plus hours each day. The committee reports that physically active people describe feelings of well-being. Overall, these individuals are 25 to 30% less likely to feel distressed. Studies have shown that just taking a long walk can reduce blood pressure. 10-minute brisk walks have shown to relax and energize participants for up to 2 hours. And researchers report that engaging in 45-minute walks 3 times a week result in reducing perceptions of daily hassles in our lives. So where do you go from here? Well, it's time to make the change. So review all the material that has been presented in these 4 sections. Read your textbook carefully. Now reflect on your own life. What can you do to reduce your stress? What are you doing to reduce your stress? Be proactive. Your health is important.